specifically are the Women's Foundation of Minnesota, are huge partners. They actually are housing this toolkit on their website, and we'll talk about them throughout today's session as well. The Center for Leadership Education in Maternal and Child Public Health at the University of Minnesota, and the University of Minnesota's Health Equity Work Group in support and partnership of this project. We had so many other wonderful partners throughout this project too, and we thank them and we are so grateful for them. So we are delighted to introduce this toolkit for you today. Kara and I would love to start by introducing ourselves. So we'll probably stop sharing our screen and go over a little bit about what brought us here today. My name is Mary Keddy. I use she, her pronouns. And right now I'm getting my Master's of Public Health in Maternal and Child Health at the University of Minnesota. Kara and I met on the first day at orientation and started talking about menstrual equity. And as someone who grew up in Minnesota my whole life, I was so excited that Minnesota came out with this legislation in 2023, implemented in 2024, that allows for all 4th through 12th grade public schools to have free period products in their bathrooms. And that was really awesome. A focus of mine that I really wanted to pursue throughout my master's program. And we found each other early on, and I'm so grateful to do so. So I'll let her introduce herself as well.
Hi, everyone. Thanks for being here today. I'm Cowell. I use she, her pronouns, and I'm also in the Master's in Public Health, Maternal and Child Health program at the U, focusing on sexual health and law. And we're really excited to be able to show you our toolkit today. I've been working in the menstrual equity space for a long time now, and was involved in this legislation when I was a college student. Back when it passed, I got to be involved in that. So we're so excited to be able to follow through on implementation and provide all of these resources for schools. So yeah, I think we're gonna jump in and get started. Feel free to ask us more questions. You can learn more about both of us in the toolkit or in some of our other materials. So we're happy to answer questions throughout. Please make sure you put questions in the Q&A. We will answer those before we answer the chat. So try and put questions in the Q&A, and we'll get to all of those at the end. We'll have time at the end, and we'll remind you to put questions there when we get a little bit closer. But we're going to start by walking through it. So I'm going to share it again. All right, awesome. Mary, is it working? Give me a
Yes,
awesome.
thank
Okay,
you.
just wanted to double check. I'm not talking at folks without them being able to see what we're talking about. So the Minnesota Menstrual Products in Schools Toolkit is a practical guide for educators and school staff created to support implementation of the state's menstrual product access law. Our research that we'll talk more about helped us identify current needs from schools, now supported by this content that's grounded in established science and best practices in menstrual health and health education. So the toolkit is now free and publicly available on the Women's Foundation of Minnesota's website. We'll point you all there more, but this is what the website looks like, where you can access it by clicking on the PDF link, the title, or the button that says download toolkit. All of them go to the same place. And that's here.
Yes, so today's webinar goal is to equip toolkit readers with an overview of content, tips, and tricks of how to navigate this toolkit, as it is pretty long. It's actually 62 pages. And we'd love to highlight additional free resources that can be applied in your own school context or community. We're going to leave time at the end, as Kara mentioned, for questions and do a Q&A live together. So please start adding your questions to the Q&A feature, and we'll try to answer as many as we can during the session. So without further ado, this is our title page. This is a toolkit for Minnesota, specifically with the Minnesota context in mind and the Minnesota's legislation in mind. The beginning of our toolkit is a set of acknowledgements for our partners, a few of whom I highlighted already today. Thank you to all of our team for helping make this possible. And this is an overview of what we're going to cover today, our table of contents. We have this button feature where you could click on any of those specific numbers and it'll jump you to the page. So if you're specifically looking for one thing, like I just want some way to talk about menstruation with cultural competency or cultural context and awareness, jump to section 5, and you can get right there with the click of a button. We also have the link to our Google Drive right there, which we're going to talk about a lot through today's session. You'll find that button throughout the toolkit as well. Which leads us to our first section, a welcome and background. We start our toolkit with a letter to Minnesota and really all of our readers, explaining the context of how this toolkit came to be. And we're so delighted that it did. It was community informed and community centered. So as such, we have some of our awesome champions of this work give a little testimony to why this toolkit's important and what this law means for Minnesota. We are so grateful for them. You can read out their awesome quotes. But that takes us to the Minnesota history. So in 2021, students brought attention to legislators that period products were needed in school bathrooms in Minnesota schools. And it took a lot of iteration and collaboration to create that bill language and actually try to get some sort of traction, make sure there was funding needed. I mean, countless conversations. In 2022, it did not pass because it was not a legislative budget year. We did need that funding. So 2023, the movement continued. And after continued advocacy, the bill passed. It needed to in both the House and the Senate. So then it was centered into the education omnibus. That leads us to when the kickoff, the starting date for requiring schools in Minnesota to have free menstrual products in school bathrooms. That was January 2024. So we are still pretty fresh with this legislation. Starting a lot of policies mid-year is a big task. So in May, right, like early on, we started hearing from schools. The Minnesota Menstrual Equity Coalition really wanted to know, like, how are things going? We created this law. Like, how is it going? We wanted to see what implementation would actually, like what was happening on the ground. So in fall of last year, 2024, the consensus was we want to pair education and resources with this legislation to make sure that implementation can actually come to life and do so successfully with longevity. So then that led Kara and I to partner with the coalition, really put our heads together and say, we're going to spearhead the toolkit creation. We've seen other states do this and do it well, but we'd like it for the Minnesota context in this Minnesota law. And hence, we describe why we created this toolkit. We highlight a few other schools, or other states, excuse me, who've done this. And there's more even coming as we speak, which is really exciting.
Yeah, so we're going to jump a little bit first and foremost into what the legislation actually says schools need to do in Minnesota. That is the primary goal of this toolkit, along with a bunch of other things, is to support schools in knowing what's going on. So the law that we keep referring to as the law throughout is a statute that was passed in 2023 requiring access to menstrual products. This section, we have like the statutory text itself, copy and pasted straight from the reviser's website, but we also have key legal requirements that are included in that statute that kind of breaks down what the statute actually says schools have to do. And basically that's provide products in bathrooms regularly used by students in grades 4 through 12. We'll keep using that language throughout, but each school district gets to choose how they implement this legislation in their facilities. And menstrual products are defined in the statute as pads, tampons, or other similar products used in conjunction with the menstrual cycle. We also have a one-pager that we'll show later that kind of summarizes the policy. Some common questions. It took effect. It was passed in May 2023, but it took effect. All schools were required to be in compliance by January 1st, 2024. And this applies to all Minnesota public schools and charter schools that serve students in grades 4 through 12. We kind of talked a little bit about why this is necessary, but for folks unfamiliar with period poverty, a lot of folks in the statistics show us about 1 in 4 students struggle to access period products on a regular basis. So legislation like this that's happening all over the country is really important to make sure students stay in school and learn where they're supposed to be. So that's kind of why this happened. We also have some steps where folks can that people can go through if like my school doesn't have products, what can I do about it? These are kind of our action steps to show folks like where they can go. And then also, Minnesota has other laws related to menstrual products that aren't directly in association with this toolkit, but we wanted to mention them. All college, Minnesota State colleges and universities are required to, and University of Minnesota campuses are requested to provide free period products in all of their bathrooms as well. So this is a higher ed thing too, and not everyone knows that. Minnesota also has laws requiring menstrual products in state prison facilities. We don't have a tampon tax. That's something a lot of folks think about when they hear about menstrual equity. Minnesota was actually the first state to eliminate that in 1981. So we don't tax menstrual products. Many states, including some of them around us, all still do tax period products. And then PFAS is also banned in menstrual products. And that's a newer law.
So how do we implement this and bring it to life? This law is unique in that it has local control behind it, meaning that every district can choose to bring certain things to the table, do things their own way, which is wonderful. Schools know their own context and communities best. However, it left some questions unanswered, such as whose responsibility is it to order the products, stock the products, educate the students on proper and respectful use, and how to get these products into the bathrooms consistently. So this implementation section is really a set of recommendations based on other schools that we've talked to, some success stories, and a big thank you to the California Menstrual Equity for All Toolkit that really did a great job and took the lead on actually finding some like formulas and data to use to actually get number quantities as recommendations for schools. So in this section, we talk about the types of products that can be stocked in school bathrooms, the definitions of them, some components to consider, and schools are doing a lot. So we really just wanted to lay it all out there. The quantity considerations page really does put into perspective how often products are going to be changed and then used each time per student per month. So really want to put tangible numbers to this. There's some assumptions on those as well. I will flag that little asterisk at the bottom of page 17 to keep in mind as you're reading this. And then we go through specific examples of storage, right? It could be something that's a formal dispenser, but those are also expensive. It can just be a basket on the counter of the bathroom sink. Like there's a lot of different ways we want to show all the possibilities for how to get this and menstrual products implemented in bathrooms. We highlight disposal systems as well and why they're necessary and why they should be readily available for students. And then a key part of implementation is how we talk about these things. Words really matter. So we emphasize that instead of saying menstrual hygiene, which implies some sort of cleanliness or uncleanliness, say menstrual health. Having a period is a healthy thing, right? How do we talk about these things and care for these things the way we do the rest of our health? And then next we have accessibility. This page is essential and crucial. Meet students where they are, support students from a diverse set of abilities. You've got different heights and reaching things, right? If products are up too high and the younger students can't reach them, right? There's tons of things to keep in mind. But specifically, we always say the word menstruator, right? Menstruator, some folks haven't had their period yet. Some folks never will. Some students, there's just so much to say, right? Let's call our students menstruators who are actively menstruating and use inclusive language where we're able.
So to jump back a little bit into local control and like what the law actually says, we also got a lot of questions from folks about like, well, period products are expensive to put in bathrooms. Like we don't have the funding for that. This law was also affiliated with a budget item. So there is funding provided by the state. As $2 per student per year in order to provide products in bathrooms. So that's funding that's specifically tied to menstrual product purchasing that all schools are distributed through like their normal education appropriations packages. So that is something that was a large like question that we got. This is not unfunded. And then it's up to every district to order, to figure out what kind of products they want, all of those kinds of things, because there's a lot of local control behind that. So we are just kind of laying out what we know and what we recommend for other schools that might be curious about what other folks are doing. And in that same vein, we heard from schools that they want to hear from other schools about what's worked and what's going well. So we did a lot of interviews and collected a lot of survey data that informed this toolkit. And one of our favorite stories came from St. Louis Park, and we got their permission to include it in the toolkit. So this is a case study of what they did in St. Louis Park that worked well, and it from one of their staff members there. So that's like 2 pages that kind of describes that. And then in order to kind of make that actionable for schools that might be asking, like, okay, so what do I need to do? Like, give me steps. We have steps. So these are what we would recommend as like an implementation checklist. And since this law has been in place for a while, a lot of schools have probably done bits and pieces of this. So we encourage them to like check, oh, okay, maybe I missed this step. Let's go back and do that. Things like that. Like this checklist and the whole like entirety of this toolkit, we just encourage folks to use what's useful to you. There is in no way like a requirement behind using all parts of the toolkit or none of it. Like use what's useful. Yeah, so that's kind of our and other partnerships and support. So we also know that even though funding's provided, sometimes schools want additional resources or there's other things that are needed. We have heard from a lot of schools that they've connected with local community organizations to do education, to get additional funding for products, things like that. So we just have outlined like some ways that other schools have done that and continue doing advocacy with their local like organizations. So to talk a little bit about menstrual health, and I will say this is my favorite section, we know that menstrual health is not required education in the law. It's just required that products are provided in bathrooms. But this has been something that we've been asked for over and over again because teachers want this and schools want this to be able to actually tell students what's going on and why the products are there in the first place. So we have pages that we encourage folks to use for education, including talking about what even is a period. What are we using these words for? What are the hormones that are changing? What can we do about pain? That's a big conversation, and encouraging folks to talk to healthcare professionals and not like normalizing pain in the way that like if a student says they're in pain, we want that to be validated because there could be something behind that. And we want folks to know that there are a lot of conditions related to menstruation. If menstruation's feeling off, we want to encourage students to like listen to their bodies and take care of their needs because menstruation is a healthy part of someone's health and growing up. So we talk a little bit about the menstrual cycle and the uterine cycle and the ovarian cycle that create that, and also provide like some basics of reproductive health anatomy because we know that not everybody gets that. So those are kind of our cycles there. And then some health habits. So how often do we have to change period products, or what is toxic shock syndrome? That gets talked about a lot. So we wanted to outline that and also just talk about the intersection of menstruation and birth control. We got some questions about how that works. And so we did all of the sources or all of the resources in this were cited and checked by medical professionals. So we wanted to make sure we provided that here as well, since we got questions on it. Health education, we know there are not a lot of great resources that folks are aware of, so we wanted to make sure to link and provide out to these. So if teachers want to use curriculum from Period, they have a bunch of different curriculums. It's one of our partner organizations, but there's also health education standards from other states. We link out to the health education standards that are currently in development in Minnesota, which will talk about puberty and stuff like that, and then link out some additional like videos. I love this Science of Menstruation video. I think everyone should watch it. So it just kind of breaks down some myths and like what is menstruation if you never formally received an education on it. Yeah, I'll hand it back to you, Mary.
Thank you. So this section is all about cultural relevance and menstruation. This is one of the things we are most proud of in our toolkit. It centers Minnesota populations first and foremost. And when we think about menstruation, there's so many components to consider. Obviously, the physical health, but there's also a social side of menstruation as well. We've mentioned so far about that it's important about the words that we're using to talk about menstruation, right? But we've also got our family context, our home life, the generations before us, and how they've talked about menstruation and taught us what to do and how to do care, and everything in between. So, some key considerations are listed here. By no means is this exhaustive at all, but we need to name that there is a unique component of cultural understanding around menstruation. It is a critical aspect of public health to consider, especially as educators and school-facing personnel in a classroom with a ton of different identities of students. So be aware that there are cultural and religious norms that shape the way we understand and think about and talk about menstruation. Really encourage everybody to read these pages. I know we're trying to race through this whole toolkit in an hour, but this is key. These are specific communities that are definitely represented in Minnesota. Somali American youth, Latinx youth, Asian American youth, specifically Hmong. We have a very large Hmong population in Minnesota, specifically the Twin Cities, and Indigenous communities. And all these community features were cross-checked with our amazing community partners who are truly involved in these contexts and communities. Kara and I, in our own positionality, do not identify in any of these communities, but we wanted to include them in our toolkit. This is so important that this is Minnesota right here and a big part of our context. So overall, education is really key. We've got amazing testimonies from teachers themselves that say, like, it's so great to know what my students are coming into the classroom with. And that's why I need to understand this context. So it's for educators, but really something that everybody could glean some awesome things from, which ties really well about how to talk about menstruation and menstrual products by grade. This law applies to 4th through 12th graders in public schools in Minnesota. And a 4th grader might have a really different lens than a 12th grader. So what we did in this toolkit was really think about the developmental age ranges, about how to talk about menstruation, broken down by what we saw as general sections of schooling. So we talk about elementary, middle, and high school. But we use the glossary for the global menstrual movement as a pillar in this section to really define specific terms and specific key overarching themes that we find through research really exist in those 3 sections. So starting off with elementary school, the key thing here is that the onset of a period or learning about what a period is comes with a lot of big feelings. Anything from excitement, I want to be like my friends, I want to get my period, to worry or fear. What is that going to be like for me? I don't know how that's going to feel. What is that? What? Questions, right? So in this time, it's really key to start off with the basics. Let's talk about anatomy, like Kara said. Name these body parts, name these terms that you'll see over on the right. The national average for a person's period is around 12.4 years old, but we've got students starting menstruation at 8, 9, right? Like we got to start talking about this so students are understanding what their body's going to go through and going through. After each general bullet point section, we've got Q&A sort of things, sample scripts that educators can use. You'll find a lot of joy in reading these, so I highly recommend you click through them. Middle school's context that I want to highlight is that often periods are most irregular at this time, specifically in the sense that students are trying to get their cadence. This is the time we find that students are often most caught off guard without products in bathrooms or themselves. Like, I was at school, I didn't know my period was coming today, got my period. So it's really essential, as for every grade, but like middle school especially, we are learning how to care for our bodies, new body odor, changes in our body, puberty, really key. And the sample scripts here are also really, honestly, fun to read as well. Takes you back to middle school for sure. And then high school, we can bridge beyond and go a little bit further into the philosophical side of stigma, of big overarching diagnoses, understanding the body, understanding themselves. And rather than telling students to just deal with it, we should be able to, as Kara mentioned, validate, listen to, hear students, and connect them with the support that they look for. 74% of students have said that they know more about the anatomy of a frog than their own, or at least the female reproductive cycle and systems. So education is really, really important and key. So we want to highlight that. And then menstruation does not end when you graduate or after 12th grade. There is so much more after that. So we wanted to highlight adulthood as well, that kind of launches you into things, right? We should be talking about perimenopause and what menopause is, right? This is going to come up and is attached to periods. As well as in the section, we talk about how menstrual health and cycles change over time. So really being in tune with yourself and having regular care, as well as we highlight the higher ed legislation in here as well for any students who are pursuing that in Minnesota. Next, one of my favorite pages is that the periods don't end when the school bell rings, right? Students are still at school often for like hours more after the classes end with clubs and sports and activities. But maybe the wing of their bathroom, their hallway with the bathroom is locked for the day because the classrooms are done being used. But what about the school gym or the visiting school that they're playing the sports team in the locker room, right? These spaces still should equip students with period products. And coaches, especially, have asked so many great questions about athletes and periods. And we want to highlight the Tucker Center at the University of Minnesota created this incredible curriculum about athletes and periods, called Coaching Her. And then Period, excuse me, has an awesome curriculum about athletes and periods, both so worth checking out.
So jumping back into like some of our additional resources in our appendix, there was so much we got questions about that we tried to keep it brief, but obviously brief is 62 pages, so there's still more. But we want to first feature that everything that is in our appendix and some of the pages throughout the toolkit that we think folks might want to print or like have easy access to are in our Google Drive. So this button goes to our Google Drive, and we'll keep referring to that. We'll kind of show you that a little bit more later, but it's basically like single page printables of all the things in the appendix or other things we think folks might want easy access to, like PDF versions, so they don't have to like pull it off of here. They want black and white. That's not going to look funky. So that's all in the Google Drive, and we link to that there. But we'll jump into, these are also all buttons. We mentioned there's buttons throughout the thing. So if you want to, if you're just like trying to get to, I need a sign for my bathroom, you can jump straight to that. We'll be talking, so this is that legislation overview page that I mentioned at the beginning. This is like a really great printable that like, if you want to tell someone, this is what the law says about menstrual products in Minnesota schools. This is a great thing you can just print off or share with folks. This is included in the appendix or in the Google Drive as well. Talks about what the law is, what it actually says, all in one page. We also got questions, especially from students in our survey about safety around menstrual products. There was a study that was published last year that went really viral, especially on TikTok, about are tampons safe? And the short answer is there's a lot of research that still needs to be done. But for now, like we don't want students to be scared. So that's a lot of fear that was created. And right now, there is no proof that tampons are unsafe. There's proof that more research needs to be done. So we kind of talk about that. This is a page that's really good for educators to like kind of know what's going on. We encourage folks to read the full study, what it says and what it doesn't say. And there's also an interview that Period did with the study, like about the study that folks can read to learn more.
This page talks about our bathroom signage. We would love to highlight this because there's specific signs that we created for different potential age ranges or even just school context. So pick and choose what you'd like. There are versions that are bilingual as well in Spanish and English. And here you can print these off. We've got black and white versions or colorful ones. They're meant to be in all bathrooms as reminders. Some ones I love to highlight are be a leader, leave the bathroom the way you want to find it. And general practices on how to keep products for their intended use and share that with your other fellow classmates. So always feel free to click through those. We have more even than what's on that little library, but you'll find those in our Google Drive as well.
And then we also got questions from educators like, I could really use a worksheet. Like, give me a worksheet where I can talk about this with my students and then like quiz them on it. So this is a worksheet, and there is an answer key also after this that includes all the answers. But this worksheet basically asks questions based on what we included in the menstrual health pages. So if you taught those 3 pages, folks should be able to answer these questions. It's very basic, but we knew that was something that might be useful. Um, yeah.
This page, was this me, Kara?
I think so. Sorry.
Okay, beautiful. Thank you. This page is really special in that it talks about how to support school facility staff who are actively in those bathrooms and seeing what's going on with those products. There have been a lot of curiosity. And in our survey, 37 schools shared that there were issues with vandalism. But then 10 of those schools talked about what they did to remedy that and how they saw shifts in product misuse to product use in awesome ways. So we shared some of those tips for redirection. Really, the heart of it is that students are curious. These are new things in the bathrooms. So how do we set the norm that these are going to be in bathrooms, that these are going to be possible when they go into the bathrooms? We really emphasize that they should be regularly stocked, fill dispensers. There's key things about like bathroom valves and water and pipes and all sorts of things with clogged toilets, a lot here, but there is a newness in having these products in bathrooms. And so we're going to have continuous reminders at the beginning of the school, such as adding those bathroom signs to make this more regular and more of a norm in schools. This section is highlighting more about cultural approaches to menstruation across the US, even across the world. And so if you want to read about awesome traditions, I mean, really cool backstories and global health, frankly, and custom, this page has a lot of awesome resources. I'd love to highlight Period End of a Sentence. It's about 29 minutes on Netflix and YouTube. Amazing story. Amazing, amazing watch. So more resources there.
Yes. And then this is our take home one pager. So if there's anything like to print out or be like, we have parents that are asking about what this is or what's actually going on in schools. This is a one pager that kind of summarizes as briefly as we can everything we've talked about. Why are there period products? Are schools talking about it? What should we talk about at home? Things like that. We will also note that this one pager is in our toolkit, but we also in the Google Drive have a parent guide, which is a 5-page version that starts with this one pager and then has 5 other pages from the health section and the policy section that we encourage folks, if the parents are asking, like, what can I use? And they don't want to read the whole toolkit or it's intimidating. The 5-page parent version is also what we translated into 3 other languages. So we have that in English, Somali, and Hmong, and Spanish. So those will be available. We're just waiting on final approvals from the translation agency we worked with to make sure that they were accurate. But the raw transcripts of all the words are already in the Google Drive, and the graphics pretty versions that are translated will also be located in the Google Drive for folks to access and use in their communities if that's needed. Then we have a flyer for school nurses. So we had school nurses were really involved in our survey process. So they were like, give me something I can print off and put on my wall in my office. So this is a kind of summary of the health page that we encourage folks to print if they're working with youth that might want to know this information. Then there is so much to talk about with menstrual health and menstrual health conditions. This is the briefest summary of it. To encourage folks to learn more about endometriosis and PCOS and uterine fibroids, PMDD, other disorders related to menstruation that can be a cause of a lot of pain. A lot of these things go undiagnosed because folks don't realize that extreme pain is not normal. So we want to try and start that conversation and encourage folks to learn more or talk to their healthcare provider if something feels off or if it's really impacting your quality of life, that's not normal. So we want to encourage folks to learn more about those.
This is one of my favorite pages in our interviews with 15 school-facing staff across the state. A lot of them said that their students want to talk. They want to talk about menstruation. They are geared up and ready to go. So we got the feedback that educators were looking for like a discussion guide, a set of questions that they could bring to the table. And so similarly, we broke these down by general age ranges, but really all could apply. Pick and choose as you see fit about having small group conversations about what periods are, where they can find support in their school, and start to break down that stigma and continue to have conversation and guide things. I also want to point out that at the bottom of a lot of our pages, you're going to see this red bar. And this is where we highlight more of those school voices with incredible quotes. Really, the people who are doing this work. And so take a look and read through those. They're phenomenal. This is our model school board policy, which we encourage school boards to do, though this law is already in effect. Because of local control, each different district has the ability to do this in their own way. So this is a sample of what you could do to outline what is going to actually be our plan for implementation in our district.
And we mentioned a little bit throughout that we did research to inform this. So, in partnership with the Women's Foundation and the Menstrual Equity Coalition, we started this project before we even created the toolkit materials at all by conducting a survey of over 250 Minnesota students, educators, staff, and they said a lot of things, and all of what was asked or said in that survey was what informed what we put into the toolkit. So we didn't just make up what we thought was important. We collected data, and that data also provided us information about like implementation status and how things are going. So we share that here, and this is 2 pages of like our data, but we're happy to talk about this more or share this more with folks. And this is one of my favorite parts of the data that we collected is the fact that we mapped it. So we can see that we got voices from all over the state. And this map is actually interactive. So if you're like, I have no idea which one of these little dots I am, because I think I know that this is this town, but maybe it's not. The map you can click out on this button to the map that is interactive, and we'll keep updating it as we get additional data points. So folks can click on it and be like, oh, okay, this is Elk River District. Okay, this is this district. Or, okay, well, I live over here and there's no data points. I know what's going on in my school. If that's the case, we would love to know about it. We are encouraging folks to add or update their school. You can fill out a little form and we'll make sure that that data gets added to the map as we continue to learn how schools are doing throughout the state. It's color coded based on the level of compliance with the law that was reported to us in our initial survey this spring. So whether products are in all bathrooms, some bathrooms, or no bathrooms. I also want to reflect that we got so many more positive responses than we thought. So folks are really, this is happening throughout the whole state, whether it's being publicized or not. Schools are really getting on board and implementing this, and we just want to give all of our schools and educators a big shout out for all of the work that they've been doing to make this happen everywhere geographically. It was very positive, our survey data. There was a lot of gratitude and a lot of like, this is actually making an impact for Minnesota students. So we just want to reiterate like how important this legislation was and that we have data to show that it's actually working. Just in case folks are printing things out or the link stops working for them on some specific day, or you want to copy and paste it into a take-home assignment. Rather than clicking on the button, we included links that can just be copy and pasted out to a bunch of our button resources, just because that can make things easier sometimes. Our full references, so everything that was related to health information or that we used in this toolkit, we have citations for throughout. And we also want to encourage folks to add your questions into the chat. We're going to start wrapping up, but please do ask us questions and we'll be getting to those pretty soon.
Thanks, Kara. So now we'd love to show you all the Google Drive to navigate through our Google Drive for you. And as Kara mentioned, we would love to answer some of your questions. So please use the Q&A feature at the bottom and we'll try to get to as many as we can. Thank you to those folks who already have added questions. We really appreciate you. But this is our Google Drive. When you open it, you're going to see a lot of file folders. The top one is some background information about what is the toolkit, some frequently asked questions that we've gotten throughout this process, how you can get involved. And then our bathroom flyer section has a ton of flyers, bilingual, color, different color waves, different grade levels. It is in association with the instructions page, which we have in here as well, instructions for bathroom signage. Only that's how you're going to match a label. But again, pick and choose what you want. Free across the board. Then we've got menstrual health resources, all of our one pagers, things you'd want to print off, things you'd want to share or email or send out, all in there. And then we have the parent take-home guide. The parent take-home guide is awesome. We would love, I mean, parents are our number one, caregivers, home life, support systems, awesome. So we wanted to make sure that they are in the loop about everything. It's 5 pages, a little more digestible, can be emailed, printed off, sent out with folks, and that's what's translated. Then we have additional resources, but for the school-facing staff. So that checklist on easy access, the model board policy, school nurse flyers, and the tips for product respect, specifically for facility staff. Our survey data is in here. And then the translated materials are in here and will continue to grow as we get those finalized guides in the next coming weeks. And then you can find the full toolkit in a PDF here as well. All these are open access. You can download them, you can print them. We encourage schools to put their own stamp or logo and customize it in a way that's going to be useful for your context. This law has local control, and that is something that can be used for strength. It's awesome. So tailor your implementation to what's going to be best for you.
We're going to stop sharing unless we have specific questions. We'll share it again if we have specific questions about things that are in the toolkit. But we're going to jump on to our Q&A section now that we've kind of walked folks through. We will jump right in. I can answer the first question. Or Mary, do you want to?
I'll read it out and you can take it, Kara.
Yeah.
The first question is, do you know if the state of New York is working on a toolkit?
I am not super familiar with all the work that's going on in other states, but I do want to shout out Period, which is an organization that's working nationally on menstrual equity. Period says yes, they are here also. So if you reach out to policy@period.org, and we can put that in the chat as well, that they can connect you with the folks that are working in New York on their toolkit. A lot of states are working on stuff like this, so we would love to get you connected. Awesome.
Another question we got was, has there been any pushback from any schools or district who believe that such matters should be discussed and taken care of by parents and not public schools? Kara, I'd be interested in your take, and I have a few reflections myself based on the interviews we did too.
Yeah, I would say based on media and some people talking about this, folks sometimes have assumptions that like this is really controversial. And menstrual equity is actually very bipartisan, very well supported because over half the population have a period and we can't control that. So in terms of pushback from schools or districts, there's been a lot of questions from districts about like, I'm getting questions about this and I don't know how to talk about it. And we know that that's part of why we created all of these resources. But at the end of the day, the law and the legislation was put in place and like advocated for by students and educators and districts who were saying like, this is a need for students in our schools. There's a lot of education can be done by schools and by parents, and we encourage school districts to work in partnership with their families to make sure that's happening in a way that fits your community. But generally, there was not a ton of pushback with like this being a requirement because it is funded and schools know that it improves attendance, it improves all sorts of things. So schools generally aren't pushing back because they've seen the need and now they have support for it.
Additionally, some of the survey feedback was this feels like a little bit of an overstep. And we got that perspective. We want that perspective and to hear that perspective. A key component that we go back to is this has local control. And that is something that is a strength that could be in its community. So we wanted to create that parent guide. We wanted to loop folks in and engage and kind of open that conversation a little bit more for those who are ready for it. Students are asking for it. And obviously, parents and caregivers have the ability to parent and caregive the way they want to do so, but there's going to be resources that we can provide to tailor that or to assist in that. And that is our main goal here. Someone asked, do you all have menopause resources listed?
We, other than the page that talks about adulthood and menopause, that links out to some other, I think we have some citations about menopause that like can provide some more information. But also just off the top of my head, we don't talk as much about it in this toolkit as we would if we were dealing with more of a menopause focused population. But we would recommend Dr. Jen Gunter has a book and some great resources that I love to refer folks out to about periods in general, but also about menopause. So if you look up that name, you'll find a bunch of resources from her. So I would send folks in that direction.
And the glossary from the Global Menstrual Movement has really awesome key terms. There's one, menstrual leave, right? Cool topics that people could read up on that are really succinct, digestible, and easy to grasp. So I would recommend sending folks there as well, which we have buttons, big buttons, clickable, that you can go out to. We have another question. How often, if any, will this toolkit be updated and changed? And also, how would you be able to send out this recording after? Kara, where's this recording going to live? And what are our thoughts on its evolution?
Yeah, so the recording will live in the Google Drive. So we encourage folks to access that. The page that we showed at the beginning through the Women's Foundation's website. So it's womensfoundation.org or wfm.org/MSP or MPST, which is our abbreviation for Menstrual Products in Schools Toolkit. That page will stay live and active, and we continue to work with the Women's Foundation. They were one of our biggest partners on this, so that page will stay accessible for eternity in the internet. But if we need to make additions or updates, we'll change them there, and that's our key spot that it's featured. The toolkit is also living on the honestSexEd that organization's website under school resources, and we're in constant communication with them too. So if something does need to change, we did go through multiple rounds of revisions and edits, so we hopefully caught everything for now. But if health standards get updated or things like that, we'll work with those two organizations to update the PDF in both of the places it's accessible online. And the recording will live in the Google Drive. I answered that. Yeah.
Yes, thank you. Thank you. Do you have any resources for helping students who may need support with their menstrual health, but may be apprehensive or shy about reaching out to a parent, to an adult? Any thoughts there?
Yeah, I think in terms of helping students can totally use this toolkit too. So we want to encourage, like we try to make everything in the toolkit at a fifth grade reading level or below. Students can find this on the internet. If they have access to the internet, they can find it. You can share it with folks. And we recommend also that adults if you have kids or you know kids, just by talking about menstruation in like public and other communities, things like that, you make it more comfortable to talk about even for folks who might be shy or be like, I don't know if I can talk about this. Being a role model in talking about menstruation or not hiding your period product in your sleeve as you're going to the bathroom, like just carry it, can help break the stigma down that might also invite students to talk about it.
Absolutely. Got a question that I love, which was how would you recommend discussing this toolkit or menstruation in general with people who feel like this topic is not for them or not their problem? And I'd love to start off this one. Kara, please add on. I think about it this way. Menstruation and having a period is healthy. We've talked about that already. And as we've also said, if you don't menstruate, you know someone who does, right? You know someone who does. And so just like with so many other things in our world, empathy goes a long way, right? This is a topic that someone you love has lived experience with, even if it's quote unquote not your problem. So with those statistics of how 1 in 4 struggle to have regular access to period products, and the fact that sometimes going home because you didn't have a period product it allows you to miss school that you are owed, that you have this amazing privilege and right to have in the United States. It is our collective community and communal, quote unquote, it's not a problem, but component that we are all tied to this. And setting a foundation in these primary years of life, 4th through 12th grade, is such a vital foundational period of child development and body development in general. This is this is a topic for everybody. And there's a lot of spaces that have destigmatized this topic already. But as I like to say, I hope that this becomes so normalized that my grandchildren one day are not going to have such stigma or shyness around this topic because we're able to actually collectively talk about it, both socially, emotionally, and physically to create overall well-being. And I just invite more people into this conversation. I hope this toolkit can be a launch pad in order for folks to do so.
Yeah, I could not have said it better. You got that one.
Thank you. Another great question was before starting this work, what sort of experience did you have working with policymakers? And related, were there any eye-opening moments or pieces that you learned while working with legislators and their staff?
Yeah, so we have a ton of amazing legislators in the Minnesota State House and Senate that were both super involved and engaged and continue to communicate with us throughout this process. Our legislators made this became aware of this issue because students in high school around the state reached out to them and were like, hey, this is something that I think we need. And that really inspired a lot of our legislators too to make this issue a priority because that doesn't happen often, but there was a lot of student voices behind it. The legislators that were involved in getting this legislation passed continue to follow up with us and with the coalition about hey, how is this going? Is there anything else you need? What can I do? And they all got a copy of the toolkit emailed to them too, that they're helping us share with their communities. So if this is something that you're seeing in your school that's working, or you think this is awesome, we also encourage you to contact your legislator, your state rep, your state house representative or senator. You can find that information online and just tell them that it's good. A lot of times legislators only get a lot of negative feedback, but a lot of the folks in our state really care, and they cared enough to pass a law like this. So we want to reinforce that this is important, this is doing good work. And I think that they're all very caring and really easy to talk with. So I think that was a really cool experience also, is they care about this because the people in Minnesota care about this.
Definitely. Before this project, I really did not have a lot of hands-on experience with policymakers, and I wanted to, right? It felt like something really far off and nothing that could be in my realm as someone who's applied psychology, public health, and child development focused with nonprofits. So, but all these things go hand in hand. I always like to say I'm an interdisciplinary girly, right? We are as great as the team around us and can help each other make these changes come to life. So I had the opportunity to take the Activate Your Advocacy boot camp through Period, which actually teaches you how to advocate in legislative settings and with policymakers. It's a free boot camp. I encourage anybody to do it. We had everybody ranging from middle schoolers all the way through advanced professionals in this course, and they taught you how to do truly create your own testimony and actively be able to go in front of a legislative session and speak. And that was so wonderful and a great way to build that muscle. And now that's empowered me to actually have a hand in policy going forward. It is for all of us to be a part of and actively be a part of in order to keep and continue and then continue to make more changes. So it's empowering, and it is for us, it is for you to actively be involved in the spaces, especially with policy. Next, who are some key people I should talk to as an educator to learn about my district's implementation plan? Any questions that individuals should ask their school district that maybe wasn't already mentioned today, hasn't been highlighted so far in order to ensure implementations actively happening in their community.
Yeah, I'm just gonna take it. I know we went through the pages fast. This is our checklist of how we'd encourage folks to be involved in this in their communities. So if folks are noticing that there's an issue before they are wanting to talk about it, they can document that. That's really helpful of okay, I saw that at this high school on this day, there's no products in the bathroom. Keep track of that if you're seeing it or if you're hearing from students about it as an educator, because then when you go and talk to a district or an admin, you can say hey, I had students tell me in September, in October, and in November that there were no products in these 4 bathrooms at the high school. Like that, keeping track of what you're hearing or seeing can be helpful in advocating for it. But generally, just who to talk to or how to figure out what your district is doing. We highly recommend you to contact administrators or the folks within your district who might be managing the budget. They should know that they're getting funding for this and that this is a requirement. So who is managing this is depending on the district, so because of local control. So it might take you a couple people to figure out like who actually knows what's going on. But if you reach out to your principal or your district admin, they should know like who's kind of managing this or if they have a plan in place, what it is. And if they don't, we encourage you to talk to your school board and bring it up as an issue. This is a law that is required and is passed. It's not something, it's been in place for over a year now. So that can help in the district specifically. And if you don't know anyone who's working on this, or you find out it's not happening at your school, you can also talk to your local elected representative or senator for the state, and they might be able to like tell you what's going on or connect you to other people in your district if you can't get through it yourself. Yeah, that's kind of our stepwise process of like who we recommend folks talk to. But as an educator, also, it would be great to talk to parent groups or the PTA or the PTO, depending on your district, or folks who might otherwise be invested in this work and get them to ask the same questions that you're asking, because that might help get it further. If parents are asking about what the plan is, that might like help you get to the right people who know as well.
Thank you, Kara. Thank you, everyone, for attending today. We hope that you learned something. We hope that you're able to see the toolkit in its final form that we poured our hearts into. We really hope that you enjoy it and you take time to engage with it. Kara, how can people stay in touch with us and continue to be involved in menstrual equity work in Minnesota?
Yeah, read the toolkit and share it with everyone you know. It's a free resource, so we want to make sure that people actually get the opportunity to use it and see it and know that it exists. And that's big and up to all of you too, as much as it is up to us. We have an Instagram if folks want to share that with young people, or if they're on Instagram, that's periodadvocacy.mn. And we're posting educational videos about snippets of the toolkit and different like pieces that might be able to be used for education or other things like that. And we also have an email that folks can contact us at, and that's mn.toolkit@gmail.com. And that's in the toolkit in a couple of places. And we're inviting folks to reach out if they have comments, if you have interest in learning more about, okay, where did this come from or what did your data say? We also are inviting folks that attended this webinar. If you or your school or your organization or group want to learn more about this or have us come talk to give the same talk in another space, we're more than happy to do that. And you can reach out to us at that email address, and we're more than happy to be involved. So we really hope this can be useful, and thank you all again for being here today and being advocates for menstrual equity in Minnesota. It's up to all of you as much as it is us. So thank you.
Thank you so much for coming. Have a great rest of your day.
I'm going to stop the recording now.